Nursing Theories Clinical Case Study. JP is a 77-year-old former professional football player. He was a very athletic man who never missed a game in his 12-year career playing for the Miami Dolphins in the 1970s. He has no past medical history and is a person who exercised and practiced a healthy lifestyle, including dietary habits.
Mr. JP, what brings you here today? I am concerned at the fact that I have a family history of coronary heart disease and heart attacks in my paternal side. Okay, we will run some blood tests and do a 2D echocardiogram.
During his 2D echocardiogram, JP's cardiologist discovered aortic valve disease, in which led him in having an aortic valve replacement. After surgery, JP was placed on warfarin therapy for strict anticoagulation therapy. After JP's discharge from the hospital, JP went to his follow-up appointment. Everything seemed to be within normal limits and his INR was at a 3. JP resumed physical activity at a light pace. He was feeling great and decided he would miss his upcoming doctor's appointment. Before he would make it to his next month's follow-up appointment, JP was walking out of his garage and struck his head on the garage door. JP's 6 foot 5 inches and was used to bumping his head into objects. He ignored the bump to his head and resumed with his day. He went to play racquetball with his son. That night at dinner time, he began acting irrational and was mumbling words.
Ow, my head hurts.
His wife soon called 911 asking for help. At the hospital, a CT scan revealed an acute subdural hematoma with an 8 mm left midline shift. He was taken for an emergency evacuation of the hematoma and had a drain placed along with a ventriculostomy for reduction of intracranial pressure. The patient's wife revealed that she witnessed JP bump his head but did not think of anything. This patient and caregiver were not properly educated on the importance of strict lab work while on warfarin, which led to non-compliance with medical treatment. They were not instructed on the extreme risk for bleeding after blunt trauma to the head. The patient was admitted to the ICU with an INR of 6.3.
Created using Powtoon.